Welcome back to part 3 of lecture 2 on your reading for module 5, which was looking at the Tacoma-Pierce County Community Health Status Report from 2013. So now we left off in your previous slide with birth outcomes. We're moving on to mortality. So mortality, since 2002, mortality rates in Pierce County have remained significantly higher than rates for Washington State. In the report, there's a lot of details about specific causes of mortality. So I encourage you to look through the report and investigate why this is, or in what departments us as Pierce County are not up to par or up to speed in terms of prevention or care. I thought this was interesting, mortality by race and ethnicity and gender. As you see, it's quite similar by ethnic group, at least for white and black non-Hispanic. If you notice, the error bars are much bigger for smaller populations. And we'll talk more about that in research class, why that is, but I thought the most striking was mortality of American Indian and Alaska Native men. It's very high, and it's definitely an issue that we could look at more, both at the level of, or not both, but at the level of primary, secondary, and tertiary prevention for this group. Top 10 causes of death in Pierce County. Heart disease is number 1. It's higher in Pierce County than in Washington State. Cancer is number 2 for the types of cancer reviewed in the health assessment. And that was statistically significant in terms of difference between Pierce County and Washington State. We'll talk about statistical significance next quarter in your research class. We'll also talk about age-adjusted rate, or adjusted rates, in your research class as well. So we see that cause of death, number, adjusted rate, and percents are all shown in this table, and just going through it quickly, it's heart disease, chronic lower respiratory disease, Alzheimer's, unintentional injury, diabetes, suicide, influenza, pneumonia, pneumonitis, chronic liver disease, and cirrhosis. So these are all mostly under the chronic disease category, and I mean, the positive side of that is many of them have modifiable risk factors that we can work really hard in Pierce County to change. So communicable disease, another group of diseases with modifiable risk factors. If you notice, chlamydia incidence, gonorrhea incidence, and when I say incidence, I mean the number of new cases out of the total population. So incidence is above Washington State and Pierce County. So there are more new cases per time period, and HIV incidence is lower. So we could potentially learn from people working on this issue and what they're doing right. Health behaviors, overweight, and obesity. This was a big problem in Pierce County. We're not meeting the healthy people target. We're over the 30.5% at 33.7% for obesity. There was a significant increase in the rate, about 84% per year between 2000 and 2009. And Pierce County residents were more likely to be obese compared to Washington State. Obesity increases as people age. You may have seen this in your clinical practice. There were no difference among income levels, education, or gender. In this report, that might not be the case when looking deeper, but on a larger population level. And in 2012, 12% of 10th graders in Pierce County were obese, 25% or 1/4 of 10th graders were overweight or obese. Health behavior. So physical activity and smoking, two modifiable risk factors. According to BRFSS, BRFS, and Healthy Youth Survey, physical activity in Pierce County is below the percentage of residents who meet recommendations in Washington State. As you can see, it's 18.7 in Pierce County and 21% in Washington. Tobacco smoking is also higher in Pierce County than in Washington State for adults and youth, where youth are 10th graders who self-reported. You can probably imagine that there are more young people and adults smoking who did not report. Residents' concerns about nutrition and physical activity. These are big concerns, and these are more difficult to modify, but they're still modifiable risk factors. This is something we can change. School lunches, they're saying, are not healthy. There are barriers to nutritious foods and community gardens and fresh food markets, including lack of transportation and availability in certain neighborhoods. There's too much access to and availability of fast foods and unhealthy foods. That's something we can change as a community and as community health advocates. So need for or lack of opportunities for physical activity. This is something we can change, and residents expressed a lack of affordable exercise programs. So what about concerns for tobacco smoking? So tobacco use and smoking and secondhand smoke and butt litter were brought up in every type of primary data collection during this process. Community health members voiced the need for prevention and smoking cessation. There's also in one focus group a concern that teens had easy access. Substance abuse was one of the top reoccurring health concerns mentioned in all community engagement settings, and alcohol and drug abuse ranked as the #1 health concern on the community survey for more than half of all survey takers. That was a lot of people. That means it was at least 200 people ranking this as their top health concern. Health insurance and health services access was another huge issue for Pierce County residents. About 3 out of 4 Pierce County residents do have health insurance, which is excellent, but doesn't meet our Healthy People goal of 100%. Those ages 30 to 44 were significantly less likely to be insured compared to younger adults and older adults. Adults with some college or college degree were significantly more likely to be insured than adults with less than high school or high school education. Unmet medical needs were a major concern in this group. Pierce County, 20.1% of adults indicated an inability to see a doctor within the past 12 months due to cost. This rate is higher than found in Washington State and is far above the Healthy People 2020 objective of 9%. Women were significantly more likely to report unmet medical needs due to cost than men. Individuals with a high school diploma or less were twice as likely to have unmet medical needs compared to an individual with a college degree. There were not significant differences between age levels found in the needs assessment. So just getting back to insurance and access, community members desired more preventive services, health education, mental health and substance abuse treatment, prenatal care, oral health, in-home health care, and immunizations. The barriers that they saw for access were racial disparities, transportation, location, unemployment, poverty, lack of trust and rapport with the provider, navigating the complexity of the health system, wait times, inadequate health insurance, language or cultural barriers, a shortage of providers, and stigma of mental health illness. Resident concerns, environmental health, were air quality, water quality, lead and arsenic, wetland preservation, upgrading septic and sewage systems. So getting to the crux of this assessment here is these were the major questions posed in the community engagement activities. What makes a healthy community? What would a healthy Pierce County look like? What are the strengths, assets, and resources of Pierce County? What are the challenges to health in Pierce County, and what are the most important health issues that need to be addressed in a community health improvement plan? So they found this data through multiple avenues, as we saw while reading the report. There were diverse voices. They tried to capture well-represented and underrepresented groups. Underrepresented groups in this context were people surveyed while receiving services at a food bank, household income less than $30,000 a year, reported not being able to usually pay for basic needs, non-white race, and Hispanic or Latino ethnicity. So this might be, so for the well-represented or not underrepresented group, this was alcohol and drug abuse with number 1, poverty, mental health, lack of access to health care, poor diet, chronic disease. The other group was similar, alcohol and drug abuse, poverty, mental health. Then we differ at number 4 with homelessness, lack of healthcare access, and domestic violence being the 6th concern. So health indicators and questions. So the selection of indicators, there were 4 criteria in this community health status assessment. One indicator was it reported in the health department's Pierce County Health Indicator Set? 2, did the indicator have a corresponding Healthy People 2020 objective? And you can imagine that when we have indicators, having a goal is really important. So this was part of it. Was the indicator listed in RWJF county health rankings groups? Was a related health concern repeatedly voiced in the community meetings and focus groups conducted as part of the community engagement process? And this is a major part of doing a community health status assessment, is seeing if the issues came up in our communities. So calculating rates, so they actually are proportions, so sorry about that. I think what I meant to say was that the difference with the rate is that there is a time dimension, which a percentage or a proportion, just a simple proportion, doesn't have. So a rate is actually measuring the frequency with which an event occurs in a specific population or defined population in also a specified amount of time. So just to give you an understanding about rates that are used very often in this report, age adjustment controls for age statistically. You will learn more about this in your research class. Analysis of trends involves grouping years of data sequentially to create overlapping time periods. This is an actual statistical method, which you'll also learn more about in your research class, most probably. And confidence intervals are, again, another statistical method mentioned in this report, and they indicate the margin of error for the value estimated by describing an upper and lower limit of an estimate. You don't need to know this for your final or for this class in particular, but just know that this is part of working with data when you're doing statistical analysis and testing. So as we mentioned, there were many secondary sources, large data sets, there were a number of primary sources. And so I'll leave you with this summary of of our assessment. Please read it, look through it, be comfortable with it.